It is now my pleasure to introduce our keynote speaker, Dr. Daniel Kraft, CEO and founder of Exponential Medicine, a program that explores convergent, rapidly developing technologies and the potential in biomedicine and healthcare. Dr. Kraft is a Stanford and Harvard-trained physician, scientist, innovator, entrepreneur, and innovator. He is also an avid pilot and has served in the Massachusetts and California Air National Guard. Dr. Kraft is going to be talking to us about the future of health and medicine and where technology can take us. Please join me in welcoming Dr. Daniel Kraft.
Wow, good morning, Philadelphia. Great honor and pleasure to be here with you today. And my clinical background is hematology, oncology, and bone marrow transplantation. And thanks to many of you, you've really helped advance that field and survivability in our patients. So huge thanks to your entire community from my clinical side. And we're going to spend the next 40 minutes or so exploring the future of health and medicine and where technology can take us. And thinking a little bit about, as you heard, about the history and where we're going. It's great to be here in Philadelphia. And thinking of revolution and reinvention, certainly Rocky's had a long career. And since this is the home of the Revolutionary War and the independence, I was reading up on George Washington, who actually recognized that one of the biggest scourges during the Revolutionary War wasn't bullets, but was smallpox, and he was a very early proponent of inoculation. So an early IP professional in the ranks there. So interesting history. So we're going to be looking at the future and today kind of through the lens of accelerating technologies. It's really an incredible time, and many of you are already leveraging these to think about the future of and creating the future and today of infectious disease and prevention and control. And I want to sort of take the lens of how do we reimagine that future? Whether it's the future of the hospital, the future of prevention. The future of the hospital may not really be the hospital. We're moving to the era of virtualized care. And in this world, though, healthcare often still feels a bit stuck, not really in the fourth industrial age, but maybe still stuck back in the third. So I want to help us sort of rethink the future. But before we look at the future, we want to have a little bit of a perspective on Back to the Future. Most of you remember this movie. It's already scary that we're past the date they went to in Back to the Future, so we're post-future. And I come from California, Silicon Valley, where we like to think we invent the future. Thank you, wow. So Kaiser Permanente started there in the 1950s, and they made this wonderful, this wonderful little movie back in the 50s about what they thought the future of the hospital was going to look like. So let's take a little perspective on what the future used to look like in the past.
A medical dream comes true under the drive of industrialist Henry Kaiser, who holds the plans of the ultra-modern hospital designed by Dr. Sidney Garfield, director of the Kaiser Foundation. From the admissions office on, everything is streamlined and expedited. The patient's record reaches the doctor before he does. This is the last word in the combination X-ray machine and fluoroscope, imported from Holland at a cost of $25,000. Every portion of the body through 180 degrees can be photographed. In the operating room, the first light of its kind is installed. No portion of an operation is ever in shadow, nor is the expectant father forgotten. Here he can get the news officially and suffer under the most comfortable circumstances possible. And for mother, well, she has only to call for her baby, and baby comes sliding through a wall in a drawer-like bassinet for a little visit with the new mother. In this $2 million institution, doors are opened by remote control, and on the single floor, patients are easily moved from place to place. Dream grounds for a dream hospital. The answer to a doctor's prayer.
The future. I'm sure all your facilities have a hot tub for your patients. That was the answer to the doctor's prayers, not necessarily the patient's prayers. I had a bit of my own Back to the Future moment. Recently, I trained in internal medicine pediatrics at Mass General Hospital. We had the 200th anniversary of MGH. I was back there with the house staff. I was an intern 20 years ago, and I was feeling a little nostalgic, so I went back to the ward, White 9, where I spent my first month as a terrified young intern. And to my shock and dismay in 20 years, not much had really changed. A little PTSD, same alarms were beeping, maybe some of the same nurses, some of the same patients. The only difference was the young intern on call had to now type the medical record. We used to handwrite it, print it out, put it in the paper chart. And what do you think the front desk was still using as the cutting edge medical communication tool of our day and age? That's right, still the fax machine. So even at great institutions like MGH and my base at Stanford and many of your places, we're still practicing healthcare in old ways, in old silos, still in waiting rooms, waiting 67 minutes on average for a 12-minute primary care visit, whether we're here in Philadelphia or in Calcutta. The modes and mindsets of how we think about healthcare, the silos already mentioned, are pretty strong in academia and pharma and biotech. And it's our opportunity, especially in this amazing group today, to rethink and reimagine healthcare outside of its old silos, outside of buckets of body parts and subspecialties, in new and impactful ways. And really even shift our thinking from our real model of healthcare today, which is really sick care, to really a proactive world of healthcare. What do I mean by sick care? Well, our models today around the planet are really based on very intermittent episodic data. Usually what we can get in terms of information outside the four walls of the clinic are very, again, intermittent. Your occasional blood pressure check, EKG, lab draw, your epidemiology screens are very intermittent, episodic. And even if you are a patient with hypertension and diabetes and you're scribbling your numbers on a notebook and faxing them or PDFing to your clinician, they often even don't know what to do with that information. And we're also, so our opportunity in that intermittent reactive world is that leaves us with a reactive system. We wait for patients to show up with an infection or a heart attack or a stroke, or in the world of oncology, most patients sadly present with late stage disease. And a big picture perspective of the world for IP and beyond is to move to a time where we get more precise with our preventions. Because today we're really in an era with mostly imprecision medicine in actuality. The top 10 grossing drugs in the United States this year only really are effective for 1 in 4 to 1 in 24 of the patients who take them. So we should move from intermittent, reactive, imprecise to a world of continuous and proactive and personalized and almost anytime, anywhere healthcare. And that's a bit of an overarching arc of where a lot of the technologies that are coming together can take us moving into this future. And it's not just to move the needle for prevention and health, but even to optimize proactively health and wellness and health span. I come from California, a lot of people want to live forever. It's not about lifespan, I think it's about health span as we move forward. So with that a little bit of a framing, I'm going to try and take you through an arc of where we are today and where we're heading in health and prevention, diagnosis, picking disease at early stage rather than late, therapy, whether that's an antibiotic or a digiceutical, and discovery. How do we all play a role in connecting the dots and accelerating the future of healthcare, infectious disease prevention and beyond around the planet? So there's a lot going on. This is actually the cover of National Geographic from January. I had the honor of being asked to write the cover article about innovations that are changing medicine. And, it's not really about any one innovation. It's about how we can integrate them in new ways to reshape healthcare. And a lot of those technologies, of course, are moving rapidly. Many of them are exemplified by the supercomputers in our pockets, riding the exponential power of Moore's law, the power of computing, getting twice as fast and half the price about every 18 to 24 months. That's an example of an exponential technology trend. That's why, the technologies we had in our pockets in the 80s or 90s are now digitized, appified. You don't buy a GPS unit or a flashlight anymore. They're basically dissolved into your smartphone. And I want you all to become exponential thinkers, because these technologies, of course, are democratizing healthcare around the planet. The bottom billion, the poorest on the planet, all have SMS phones, and soon we'll have smartphones. And you need to have sort of that exponential mindset. But our brains are wired linearly. 30 linear steps, I'll be across the room, but 30 exponential steps, doubling, 2, 4, 8, 16, 32, 64. By the 30th step, I'm at a billion. That's trillion steps. That's 26 times around the planet with that 30th step. And that's a bit of the power, the surprising power of exponentials that can play a role across the world in almost every field, but particularly can play a role in healthcare. Oops. Technology in the clicker is challenging. So I want you to be thinking about the power of exponentials, again, sorry, but also the perspective on how quickly the world is changing, right? It's sometimes a bit deceptive. It's only been 12 years since the iPhone came out, since Twitter launched. 10 years ago, Airbnb was still basically a mattress company. Facebook was just coming out of universities. A lot's happened in the last 10 or 12 years. The next 10 years will make the last 10 years look slow. So I want to challenge you to think about what's the potential for now, the next couple of years in your field, what's coming in the next 5, and how do we really think about reshaping health medicine and especially infection prevention over the next decade. So lots changing. Part of the changes are what's all in the power of our pockets, giving us new connectivity and empowerment as consumers, as patients. You can compare, one hospital down the street to another. You can go to a Yelp for doctors like Vitals.com. GoodRx is a $1 billion startup, lets you compare drug prices. If you're looking at surgeons and their infection complication rates, you can now go to individual hospitals, individual surgeons, procedures, and look at how they're doing. That's a lot of power and control. So the power in our pockets is quite profound, and it's not just for communication or looking up doctor ratings or hospital ratings. These, are, of course, are coming into our medicalized smartphones that now have a huge number of sensors, from the camera to the microphone, including in the infectious disease detection realm, just published academically last month. You can put a little paper sensor on your phone using the microphone, basically pick up ear infections. So another sort of screening tool that's being digitized and democratized. So in this exponential age, what used to fit on your desktop now fits on your smartphone, now fits on your smartwatch. The watch now becoming an FDA-approved diagnostic device. And that leads us to an era where these old devices are becoming ubiquitous and everywhere. They're computers the size of a grain of rice that have the memory of my Apple Watch that are, of course, becoming connected in this world of Internet of Things, or really the Internet of Healthcare, Internet of Medicine, which is now, as of this year, not just riding 4G, but 5G, which is about 100 times the speed of our 4G networks. So a tremendous opportunity to reshape healthcare, leveraging these high-speed networks. And this healthcare IoT, of course, is coming to the world of infectious prevention, or the ability to do surgery remotely on a 5G network, as was just demonstrated in China. Or to rethink how we do hand washing. I've never washed my hands so many times today. Essentially new ways to use Internet of Things to go high tech, as many of you have been developing going forward. So the Internet of Things can track your devices, can track your hand washing, whole new ways to reinvent very common elements that are so important to health and prevention. Now, of course, these new devices create a ton of data, right? From your genetics to your digital exhaust, epidemiology, lots of data, often very siloed, not yet connected, that we really need to reconnect if we're gonna take advantage of all this new knowledge and bring that to reality. Because it's not just about exponential data. Data's fine, but we want that to be actionable information that then turns into true knowledge and clinical utility at the bedside, in the clinic, in the community, in public health. Big challenges of closing that gap. So as we move forward, technology certainly plays a role, but as many of you know, it's incentives, it's policy, it's payments that really have to collaborate with this. It's understanding our incentives, which in healthcare are often quite misaligned, right? Here in the United States, we still practice, sadly, not evidence-based medicine, but reimbursement-based medicine on the right side of the slide, right? 80% of our healthcare costs for 20% of the population who already have advanced disease. We're starting to see and start to pay for health, wellness, prevention on the left side of the equation, something that many of you focus so much on. That's starting to be rewarded in our era of now value-based care, where you're gonna pay for good outcomes and drugs and devices and platforms that work, not just for prescribing. Now, we have to be careful about what we incentivize, with the changes in reimbursement, to not reimburse for, let's say, heart failure readmissions within 30 days. No surprise, readmission rates went down. But was that really changing mortality? In some cases, actually not. Patients weren't being admitted maybe when they really needed to be. So be very careful what you incentivize. Including in the infectious disease world, a great expose in the New York Times about the misaligned incentives for animal farming to give antibiotics sort of proactively, which has huge downstream impacts in the infectious and drug resistance world. So let's look at some of the incentives and how they're shifting. Of course, healthcare is, again, increasingly moving from the hospital to the home, to our phone, to even inside our bodies, to the corner pharmacy, which is battling it out to become your primary care provider, and that can often even be done remotely and virtually. So huge shifts about how and where we get our care. And that provides new opportunities. It's often kind of buzzwordy: connected health, mobile health, digital health. I think soon we'll just call it health. But the ability to connect the dots between new data sets and action and information and knowledge are really becoming a game changer, are really only accelerating in the last 10 to 20 years. And it's not a panacea, digital health. Just prescribing a wearable isn't going to mean someone's going to lose weight. So we're starting to study this in new centers. What are the role of some of these new connected devices and data from genomics and beyond? So when we're thinking about the future, whether it's IP or any other element, don't just think about sensors for hand washing, but what's happening in AI and 3D printing and genomics and synthetic biology and virtual reality and robotics, all coming together and converging, actually super converging, in really powerful new ways to allow us to address grand challenges across the healthcare continuum. In fact, creating entire new fields, from computational biology to AI meets radiology to robotic surgery. All these things are converging and enabling us to address grand challenges across healthcare, from rising costs, aging populations, challenges with access to care. So no matter what happens to Obamacare or Trump care, which is really no care, or Putin care, whatever we get, we need to think about extending access. I'm sure there's a shortage of infectious IP professionals in many parts of the country, let alone the world. We have the challenge of lots of data coming at us, but how do we make that information not transmitted by fax machines? How do we help the F word, the regulators, the FDA, improve their ability to regulate and bring new solutions to market, and the payers, who have the hammer on incentives, pay for new solutions? Of course, a lot of this isn't high tech, as already mentioned, vaccination, something so critical, social determinants, clean water, good food, access to vaccines, social connection, huge important elements. And often our zip code is more important than our genetic code in terms of health outcomes. And a lot of that relates to epidemiology and public health. So we have to pay attention to the base of the pyramid, right? Our key needs. Of course, today in our technology world, we have some new physiologic needs, Wi-Fi, and number one, of course, is battery life. But we can reimagine this. We already heard about the word disruption, right? I come from Silicon Valley. We like to think we're the home of disruption. Uber used to be the favorite example of that. Think about companies like Uber. Uber's only 10 years old, just had their IPO. Companies like Uber and Lyft are exponential companies. They didn't invent the smartphone, GPS, online payments, taxis, or limos. They connected the dots. And soon they're going to be disrupted by self-driving cars. And certainly the drivers and the future of work is going to change in that realm. And everyone wants to Uberize everything today, right? Human Uber, developed in Japan, provides a way to attend events remotely using another person's body. It's surprisingly natural, says it's better. So next time, come to APIC, send your Human Uber, right? But seriously, even Uber themselves is getting into healthcare. A pilot in New York City last year, you press a button on the app and a nurse would come to give a patient a flu vaccine. Many folks don't get their public health measures and their preventative measures because they have difficulty with access. You can Uberize that, for example. So literally, Uber and Lyft are delivering patients and medical elements. So disruption and change is coming, from ordering a doctor or nurse to come to you on your app to delivering your drugs. We're seeing, the big players, Amazon, Google, come into healthcare. Amazon getting into the pharmacy space. So soon you'll maybe get your antibiotics or preventative measures delivered to your hospital, clinic, or home by drone. No kidding. That's not science fiction. Disruption is coming to our friends in pharma. One size fits all drugs, antibiotics are all shifting. Disruptions coming to our friends in the payer world. What if we could interact with our payer in much more seamless ways? Boy, I need a new clicker. So changing the way we interface with our payer, it can be fun. So as we look to the future and disruption, recognize that a lot of things have changed, right? Blockbuster's gone bust. Kodak essentially went bankrupt. Kodak, you might not know, they actually invented digital photography, but they didn't want to cut into their film sales, and they went bankrupt, and 12 kids down the street from me in Palo Alto sold Instagram for $1 billion in 2012. So change is coming. My takeaway from this section is you want to be the disruptor, not the disruptee. You want to be Ubering yourself before you get Kodak. So that's my takeaway. So how am I, as a medical doc, playing a role in this, future medicine? Well, I've had an interesting role for the last 10 years on the founding team and faculty at something called Singularity University, based in the heart of Silicon Valley. We bring really smart folks together to cross-train in AI, robotics, 3D printing, nanotech, genomics, and beyond, and ask, how do we address grand challenges from poverty, education, infectious disease, to global health? And what's been interesting about the programs and the folks who've come out of this is about half of the new endeavors and startups have been focused on healthcare, often coming from non-traditional medical folks who bring their skills and knowledge to reinventing healthcare. And because medicine and healthcare tends to be quite siloed, I'll go to oncology meetings, you guys go to infectious disease meetings. I started a program now 8 years ago called Exponential Medicine. It's grown exponentially. We bring about 800 folks together every fall at the Hotel Del Coronado in San Diego to ask, what is the future of medicine, from blending all sorts of fields. We had 44 countries, 50 specialties, technologists, nurses, patients, investors, all kind of touching the future and getting out of their old silos. And the head of innovation from NHS shared this old quote: the difficulty lies not in the new ideas, but in escaping from the old ones. So you heard a great short history of your field. What are the old ideas that might be holding back the whole world of infection prevention and beyond? Get out of your old mindset, because it's starting to play with these new technologies that gives us new opportunities. Even the FDA came and was learning about new connected devices, and that helped them spur their new software as a medical device initiatives to speed new innovations moving forward. So hopefully some of you can come join us this November. Lots of technology and talks at exponentialmedicine.com. Okay, Let's now go through 3 areas quickly: health prevention, diagnostics, and therapy. I'm already going to talk fast. I'm going to give you a link and a phone number at the end of text to get a copy of most of my slides. So apologies for going fast, but there's a lot going on. Let's start with your sweet spot, prevention, right? We know that prevention is key, often tied to our behaviors, whether it's not washing your hands, to a poor diet, smoking, stress. Our bad behaviors lead to most of our chronic conditions. So now we're only about 10 years into the era where we can start to measure our data. Actually, 15 years ago, I did a project with NASA where we built a black box for astronauts, this big kludgy device kind of for the space station. But now, 10 years ago, only 10 years ago, the Fitbit launched. That's our ability to start measuring our behaviors. How many of you are wearing a Fitbit or some other connected device? I'm curious. How many of you lost one? It's in your drawer, you lost the charger, right? How many have ever used or been prescribed one by a doctor or used one in your clinical endeavors? Almost nobody. So I think this is going to create a big shift. I'm more like 5 devices right now. But you know, we can start to measure now almost every element of our physiology and behavior using these sorts of technologies. And it's going just from the accelerometer on our wrist to sensors that can go inside our pills and our antibiotics that tell when a patient is taking their meds to improve adherence, to patches that can track vital signs, to, you know, simple technologies like a Fitbit can be used to tell as a patient after surgery doing better, walking more, or walking less. So sort of sometimes simple measures can be used in powerful ways. We're moving, in a sense, in summary, from an era of quantified self. Many of us are data geeks. The data's on our phone. To quantified health. That data is going to start to flow to each of us as healthcare providers in really impactful ways, and using that to measure and hopefully optimize health, wellness, prevention, to diagnose early, and then if we have a disease, from cancer to diabetes to tuberculosis, to measure and have feedback loops to optimize therapy. All right, so what can we quantify today? You know, the digital scale. We can go beyond weight and start to measure shape, whether you want to or not. This is the shape scale. It gives you your kilos, your body mass. Maybe that could be uploaded into your medical record. That could be important. So shape. Or what about something super common? Hypertension. The #1 leading cause of early death and morbidity around the planet is high blood pressure. About half of adult Americans have hypertension, less than half of it well controlled. Well, now you can get a connected blood pressure cuff in your corner pharmacy or in Best Buy, or launched this year was a blood pressure cuff that's built into the watch band. So new ways of collecting very important clinical data. And using these can dramatically improve adherence and blood pressure control in clinical trials. All the way to next generation of wearables that will be seamlessly collecting real-time blood pressure without squeezing anything. So lots of new basic sensors can come along. So wearables in our watches, to our shoes, and going beyond wearables to even insidables, contact lenses that can start to track our blood sugar, or chips underneath the skin that can start to measure everything from blood oxygenation to signs of hyperkalemia and signs of infection. We'll start to chip our patients in the next 10 years in interesting ways to help manage chronic disease. Going beyond wearables, insidables, trainables, right? In our smartphone era, our postures aren't often very good, lots of issues with lower back pain. What if you put a little device on like this one? You can buy it on Amazon, called Upright. It's like your digital mother. You put it on your back, and if you're not having great posture like I often don't, it senses your posture. And if you're sort of hunched over for a few minutes, it gives you a little warning. About a week of wearing this, boop, it changes your posture. And it's a small example of something giving you a feedback loop, right? So trainable. Some of us need something more, shockables. That'll get us going. Our hearables, our music devices don't just play music. Some of them can track our steps and our heart rate and give us coaching. Ringables are basically Fitbits on the finger that can provide lots of data, including sleep. You can track your sleep, optimize your sleep, new technology for that. And even other things that are surprising we can start to quantify. Breathables, right? Molecules in our breath can be signs of infectious disease, signs of cancer. Are you going on a date? Check the quality of your breath. Other fun elements, underwearables, that's my new favorite. I won't show you the one I'm wearing, but these are getting so cheap and ubiquitous. You get a pack of 10 of these little cheap sensors, and they track your respiratory rate, your steps, your heart rate. They started in sort of the consumer space for optimizing your stress and meditation, but with new incentives, new CPT codes, we're getting to get paid for remote care monitoring. So this company's pivoting into tracking changes in COPD, respiratory changes and flares, to keep people out of the hospital who might have pulmonary issues. So new ways of paying and using these connected devices. The #1 drug, Hippocrates said, let food be thy medicine, medicine by the food. Quantifying our food, we can measure input, output. Is that food infected, for example? You can also start to measure output. Lots of data there that relates to your field. True, lots of startups in that space. And we're entering an era of sort of precision medicine, using microbiome, genome, continuous glucose monitors to start to personalize our diets. Tons of potential happening in that space. Or tracking the health of the pregnant mother and the fetus. Lots of ways to get data in a simple wearable form. We can go too far, tweet P, that's a little too far, okay. Now we're even entering the era of invisibles, and this is particularly important to picking up signs of infection, right? Now we're in an era where chips under your skin can track you, where cameras can start to track the health of the baby in their crib. Just the camera alone can pick up resting heart rate, respiratory rate. Are they breathing faster? Maybe picking up RSV or other problems in kids at home or in a clinical setting. We're seeing now cameras can pick up and track the health of folks aging in place. You know, are they drinking enough? Are they upright? What's their behavior look like? A little bit, you know, big brother, but that's available today as well. Wi-Fi has been modified to pick up the vital signs of up to 10 people in the same room, so you can start to pick up vital signs seamlessly, including patterns of behavior, moving, eating, toiletering, sleep, and that can be used up to signs of infection as well, or even how, you know, your whole sleep cycle. And this is a great example. I just saw this company, I was in Calgary last week, using AI machine learning for something you guys are very familiar with, hand washing. A little sensor that's wearable, doesn't need to be, it's always with you, can watch. Are you really washing your hands? Understanding, are you doing the proper hygiene control? Are you safe to see that patient? If you're not, maybe give you a little buzz or other way to keep you from doing the wrong thing. So these things are all blending together in new powerful ways. So the bottom line is we're entering an era where we're going to always be online with our digital exhaust. And there's some new incentives coming to keep you from... Insurance companies will give you a better premium, so someone's going to hack this, right? But just because you can collect all this data, it's still a bit of a so what, right? Many of you are overwhelmed with data, right? This is a slide from Exponential Medicine. What is it, Doc? Just as I thought, you're generating too much data. We don't want more data, we want useful information. Many of us as clinicians in many forms are overwhelmed with horrible workflow, epic fail, right? Spending twice as much time, you know, charting than actual time with our patients. So I know you're all familiar with the triple aim. We need to move into that quadruple aim of improving the clinician experience as well, not just adding more technology to the mix. And that's starting to happen, right? On our smartphones, we can start to integrate our clinical data and share it. That empowers each of us as clinicians and as patients to own our information and be partners and co-pilots in our care. It means we need to think about how we interact with that data and design better systems, from your hospital room to our apps, right? To new clinics that can transmit that information in seamless ways. And just because we have this data doesn't mean we know what to do with it. We're in this new era of digital exhaust. So Google Health, Verily, Stanford, Duke are doing this baseline trial. 10,000 volunteers sharing their digital exhaust, their genomics, so we can understand what do these new real-time measures mean outside the clinic, outside the four walls. Or the NIH has done the All of Us trial, which you can all still sign up for, to donate your digital data, your digital exhaust, your genomics, to build a Framingham on steroids. So real opportunities now to connect the dots with this data and make it super useful. And hopefully that takes us to an era of predictalytics. Just like a FICO score for your health, for your financial health, you have a FICO score for your personal health that integrates lots of data. Just like our modern cars have 300 or 400 sensors, we don't care about any one sensor. We care about when the check engine light goes on. What if you had a check engine light for every patient or community center where there's a sign of infectious disease brewing early rather than late, from the convergence of all this new data? So it's not going to just be the sensors, it's going to be the platforms, the apps, the new AI that makes sense of all that coming together. And that's becoming a reality. Check engine lights for the body. This is Dr. Snyder at Stanford. He picked up the fact that he had Lyme disease, an infectious disease, based on small changes from his wearable data. So that's going to become reality going forward, not just for the individual, but in society, connecting the dots. Just like Teslas, when they drive down the road and they learn that's a dangerous curve, they don't just update the map for them, but for all the Teslas, the hive mind. So this hopefully brings us not just from data, but to change, behavior change, whether it's hand washing or wearing, it's hard, right? What if we had new ways of coaching, right? Google Coach is coming out for health. Coaches are coming to avatars that can interact with patients and clinicians and help coach them to do the right thing. They won't be real in many cases, but they'll feel real, right? So, and these coaches will come to our voice. Many of you have Amazon Alexa. Alexa's becoming and Google Home on voice as a tremendous platform for healthcare, including in the clinic to listen to patient engagement, to give you data in the home. Alexa, how many calories in that pizza? How much insulin should I take? Alexa, help, I fawn, I can't get up. Call 911. All those things are coming together. And there's sometimes unintended consequences of these technologies for good and bad. Here's an unintended consequence of technology with voice. Take a look.
Play jazz.
Playing jazz.
Smoothie.
Making smoothie.
Calendar.
No meetings today. Remember, dentist at 9:30.
Fire off.
Fire off.
Open door.
Door open.
And we're gonna do one more.
All right. Open door.
Wrong voice command.
Open door.
Wrong voice command.
Open. Open door.
Repeat that.
Open door.
I didn't understand that.
Hey, open door.
Play on the floor.
Get over the door. Open the door.
Wrong
Open the
voice
door.
command. Error.
Hey, there. With a rock. Open door. Open door.
Higher volume. Higher.
All right. So you made the best technology, but pay attention. All right. So imagine you had your health coach, right, that integrated your score, gave you data that matched you and your personality, right? It's different if you're a baby boomer or a millennial, how you communicate. It might show you not just you of today, but you of tomorrow when you look in the mirror. You of tomorrow, you're doing your workout, your P90X, you of tomorrow. What if you kept having Dunkin' Donuts for breakfast? You of tomorrow, right? I love Dunkin' Donuts. Here's me now, here's me 1,000 Dunkin' Donuts later. That might give me a pump. Or if someone who smokes and you can show them their face before smoking and after smoking, that can be a powerful lever. Or if you spend too much time on social media, that can be a change. So seeing our future self. And this brings us to one of my favorite convergent areas, augmented, virtual, and extended reality, right? This is my antique 6-year-old Google Glass, right? They used to be amazing. Now, they weren't a great consumer hit, but they've had a lot of applications in healthcare, from surgeons and doctors using these. There's now HoloLens coming out to enable us to communicate and see clinical information in new, powerful ways. We're seeing it being used in the operating room, and I need my volunteer to come on out, to empower clinicians. And we can use this even to understand our own health and medicine in new ways. So Caroline's going to be my safe, hopefully a quick demo. Live demos are always dangerous here. Let's take a look inside sweet Caroline here. And here we get a look at her insides. Like, here we go. This is augmented reality. We can take a look maybe at her circulatory system as well, if you can all see this. Get another look, right? Oh, she's got a good heart, good heartbeat. We can even take a look inside and look at her ejection fraction. I think she looks great, inside and out. Thanks. Just wait till you get my bill. So, this can engage kids, and you're trying to educate nurses, patients, doctors. You can make things engaging with these sorts of things. My son Leo, at 3 years old, knows his basic anatomy and physiology. So sometimes information can be power and used in engaging ways. And these technologies are getting quite magical. As was mentioned earlier, I spent 13 years as a flight surgeon in the Air National Guard, taking care of fighter pilots and flying. I've been a pilot. We use virtual and augmented reality in the cockpit, right? You can see where the bad guy is. The plane will sometimes talk to you. If you're about to hit a mountain, it'll give you a little clue. That's important. What if we could use that for behavior change, right? See your breakfast in one way, then another way, and get a little nudge, right? And then, even more exciting is the world of virtual reality, right? How many of you tried VR, right? It's not just for games anymore. We can use it for therapy. Folks who have burn injuries, you go to a cold environment and they throw snowballs at penguins, they use less than half the amount of opiates. It's being used in physical therapy to get folks engaged in their physical therapy. It's being used for folks stuck in hospitals and BMT units to be at the beach and less stressed out during a procedure. It's being used in education, right? That's how I used to learn, see one, do, and teach. When you barely see, there's a shortage of surgeons in many parts of the world, surgical education. Now you can do virtual surgical education. I was in London 3 years ago for the very first live stream VR surgery. My friend Shafi Ahmed live streamed to 5,000 students around the world this surgery in helping engage and empower. Or you're trying to simulate a procedure, whether it's anything in a clinical setting or outside, the clinician is going to practice it like a flight simulator hundreds of times to get it right. So not from see one, do one, teach one, but see one, sim one, sim one, sim one until you get it right. So that has implications across every field of education and healthcare. So imagine we start to pull all this together, ways for surgeons, ways for infectious disease, epidemiology. CDC already puts maps together. What if we could be using that to not just do driver assist, but clinician assist? That's starting to come and blend to the surgeon, so they're not going to be doing the entire procedure. The robot will blend with what they can do. Let's switch to something that you guys spend a lot of time on, diagnosis, right? We're gonna pick up things early rather than late. We now have a whole new set of tools, digital tools, that can go outside the normal four walls to enable us to do that, from looking in the ear to tracking ear infections, and now even home-based versions. So if you're doing a televisit, you don't just look at the doctor on the screen. You can now, in a Best Buy, buy this kit, and the doctor or nurse can listen to your heart and lungs and inside your ears and mouth, all connecting that with consumer-based devices. We're seeing, now FDA-approved devices that can track patients at home. Do they have a fever? I mean, my field of hematology oncology, fever and neutropenia. What if you could pick up those fevers early and do blood counts at home and keep them out of the hospital, maybe even deliver the prophylactic antibiotics by drone? We're in a time now where we can replace the stethoscope, right? This is a digital stethoscope from Berkeley. You can now listen to the heart sounds. It has an EKG built in, and machine learning can diagnose a heart murmur much better than I can or most highly trained cardiologists. So in the hands of almost anyone, you can upskill them to have the diagnostic acumen of a master cardiologist. Or you can also now buy a home consumer ultrasound device empowered by artificial intelligence, which can democratize diagnostics anywhere from rural, Pennsylvania to rural Africa. So huge new ways we can bring diagnosis almost anywhere. All the way, of course, to your Apple Watch, which now is a tool for picking up things like atrial fibrillation. It can be that check engine light for the body for picking up problems, and it's going to get even more and more powerful on our wrist. All the way to now where there are patches, basically Band-Aids that will live stream a patient's vital signs in the hospital or outside. They can give you signs of infection or other elements proactively with a Band-Aid for $1 a day. Now, let's say you do pick up signs of heart disease. Do you need to do the old-fashioned angiogram, the guide and the needle and the dye in the heart? Now we're entering the era of virtual diagnostics. This is a Stanford spin-out called HeartFlow, a 30-second CT scan of the heart, send it to the cloud where it's computed, and you can now measure computationally how narrow are the coronary blood vessels. Does that patient need a bypass or a stent? What kind of stent? Maybe we'll 3D print a stent to match the patient's anatomy, right? That's going already through the FDA. Then, of course, the laboratory. You guys spend a lot of time doing laboratory analysis. The laboratory, despite disasters like Theranos, is really moving to the home, to the basic chip with microfluidics. We have a whole new set of technologies you can start to plug in. Actually, you can even draw blood very easily now with a little device like this, no venipuncture, draws a whole blood sample, drop it in the mail. Or we're seeing the advent of little devices you can do on your mobile devices to do everything from hemoglobin A1C to picking up and doing PCR, essentially on a USB-sized chip for infectious disease. Sepsis detection, something you guys spend a lot of time on. There's now the ability to look at circulating DNA from bacteria, viruses, fungi, and analyze that. A Stanford spinoff called Carius is doing that to pick up sepsis, days before you get the blood culture back. So new powerful lenses for that, or others like MeMed that look at your immune system and can tell if you have a viral infection or bacterial. So very rapid ways of screening, and hopefully then applying the right therapy at the point of care to prevent downstream infections and spread. But what about doing a laboratory without a laboratory? The idea of a medical selfie, right? With the exponential power of our smartphone cameras, you might have a patient where you want to screen them for a urinary tract infection. You don't want to bring them in with their urine. You, in the privacy of your home, just dip the urine with your Norman dipstick, take a picture with your smartphone camera, and boom, it does the analysis right there and sends it right to you, the doctor, the CDC, the NSA, whoever else wants it. And that's the power of, diagnostics on your smartphone. Another company has developed a way for screening for respiratory issues. You spit in this, and the little lines show up. You take a picture with your smartphone. It analyzes, do you have RSV or Ebola, right? And then you don't have to bring anybody in and get them infected. Or the ability to look at wound care on your smartphone as well. A huge issue in infectious disease control can now be quantified in very powerful ways. And the last example of a selfie, you can even take a picture of a child with maybe a genetic issue, you're not sure what it is, and using machine learning and data, understand that they have, a very rare element, genetic disease, without even doing a sequence at all. What else has changed exponentially? The price of sequencing, genomics, something that's certainly coming into the infectious and digital and epidemiology world. The price of sequencing has dropped at twice the rate of Moore's law, from millions of dollars to less than $500 today, soon to be $100 or maybe even free. And clearly it's playing a role in individualized medicine and personalized and more precise epidemiology to pick up, understand what bug you're dealing with, virus, bacteria, and then have a specific intervention, whether it's a vaccine or an antibiotic. So huge power coming to the world of this realm to do both understand the genomics of the pathogen and the host, and then to personalized therapy. So tons happening in that space. And then, of course, there's personal genomics. You can do even your 23andMe profile and understand your pharmacogenomics, what drug, what antibiotic, what statin is going to work best for you, what drug, what dose, what selection. You can do fun things. I've had my genome done and turned them into personalized socks. That's one way of engaging. I have very personal socks. But more importantly, we can start to understand core diseases at the genomic level. Diabetes is not one disease. Using machine learning and analyzing several thousand type 2 diabetics, there's at least 3 distinct subtypes who respond differently. Same thing's going to go with how folks respond to prevention and therapy for infections and autoimmune disorders. And we're getting to an era now where we're going to be much more proactive, right? Who's at risk of certain disorders based on simple genetics? Risk of heart disease, AFib, diabetes, breast cancer, inflammatory bowel disease, and using that information proactively to hopefully screen earlier and prevent those diseases from happening. And of course, now we're going beyond the genome, the proteome, the exposome, and the microbiome, something certainly in your sweet spot, an area that's moving very, very quickly. I'm sure many of you had your own microbiome done. I've had mine done a few times. It's becoming a lens to issues like Crohn's disease. This was just published last week. The bugs in our gut may play a role in Crohn's disease, or certainly a role in cardiovascular disease. So think about maybe the world of IP is going to move not just for infectious disease prevention, but other diseases that are non-infectious moving forward, even a role in preventing Parkinson's and neurologic disorders. And of course, we're in the era now of treating C. diff and other infections with fecal transplants, and soon maybe rebooting microbiomes of folks with more common issues, from obesity to depression. All right, I've already thrown a lot at you. Now it's overwhelming. So it's overwhelming to the patient, to the clinician. How do we connect the dots and take all this information and use it at the point of care? Well, we need new tools, right? Artificial intelligence, AI, I like to think of it more as IA, intelligence augmentation, is playing a role in starting to really get beyond the hype to play a role across healthcare. So a few examples, most of you have seen, smartphones that can take a picture of a rash or a lesion. Is that a melanoma or a mole or some Ebola rash? That can be done remotely and cheaply and be helpful for epidemiology and public health as well. We're seeing the ability to do better than radiologists in reading standard chest x-rays and picking up and diagnosing everything from tumors to other challenges. Pathology is becoming digitized and already can be trumped by AI pathologists. You can look at the back of your eyeball and pick up signs of both infection and cardiovascular disease and many other elements. So we're entering an era where, again, with simple tools and machine learning, we can diagnose and prognosticate going forward. So it's an interesting time to where the point in the next few years, we'll have essentially a medical tricorder in your pocket that you'll have at home that'll enable almost anybody to pick up heart rate, respiratory rate, blood pressure, talk to the AI, and be used for proactive triage, infectious control, prevention, screening, in the privacy of your own home and in your pocket. And create almost a digital twin for each of us and each of our communities and patients to integrate all this data. So I think AI is very exciting. It's not going to replace the doctor, the nurse, the specialist. We need to blend what each can do well. Humans are well with cognition and empathy and decision making. Machine learning has its other tools. So AI is not going to replace the clinician, but the clinician using AI will replace those who don't. All right, last couple minutes, I'm a little over time. Therapy, lots happening in therapy, from gene editing, CRISPR, to cure diseases like sickle cell and thalassemia, and maybe even HIV, all the way to new ways of doing drug delivery and providing antibiotics and other infusions. Sometimes without an infusion or a subcutation, there's now pills that are being developed that are robotic that can go in your gut and inject biologics, for example. So new ways of drug delivery are coming along. We're seeing, I met a woman on the plane flying out here to the same conference out of California, Cirrus, new ways of proactively removing infections from blood as a way of therapy. I've done a lot of blood and platelet infusions, new ways of being proactive there to knock out the problem ahead of time. All the way to robotics playing a role in the operating room and in the clinic to clean it out. We mentioned robotics earlier, everything from surveillance to augmented sensing, augmented reach, all is going to be amplified with robotics. And then there's electroceuticals for therapy, not just pacemakers for the heart, but for the gut, for Parkinson's, electroceuticals for treating sleep apnea, electroceuticals underneath the skin for remote contraception, which leads to issues, honey, where's the remote? Or what if someone hacks your remote, or someone hacks your pacemaker, or someone hacked your hospital? A lot of issues with privacy and data. We need to bring in new fields like blockchain and as a tool to make medical data safer. And then there's the era of virtual visits. How we're going to interact with our care. How can you do virtual visits to screen for disease and do epidemiology is coming to our mobile devices. Chatbots are being increasingly used as ways of doing triage and getting basic information. We're going to feel like we're in the same place with a lot of these new AR and VR tools, so you don't have to always bring people into the clinical setting. We're in the era of prescribing apps, whether that's apps to do education or keep patients on top of their meds or manage their hypertension or mental health issues or infectious disease, are becoming digiceuticals and going through the FDA and becoming approved. There's so much out there, it's a bit overwhelming, so I've recently launched a very early version of a website called digital.health as a place to find a digital formulary of the tools, devices, and platforms that already exist that you might want to use today in your field and beyond. I'll finish up with the last example of exponentials is 3D printing. Not a new technology, but getting exponentially better. You can 3D print braces, hearing aids, orthopedic devices. We've even seen 3D printers go to the space station, so you could print a ratchet or a medical device. Hard to get a medical device to the space station. Or what if you could do something to address the issue of adherence? A lot of patients with infectious disease take a lot of meds and many other elements. So I've been looking at this specifically to create a new solution, to take all this data and pick the right drugs and combinations, but then not to have a pile of pills, and track it like this, which are a cutting edge way, but to 3D print your pills. What if you could, instead of, again, taking multiple pills, build a pill that was personalized and matched to you? So I call these IntelliMeds. We have a little new startup called IntelliMedicine. The idea of putting together your personalized pill. It might be your aspirin, statin, beta blocker, or your combination of antivirals that match an individual patient and optimize adherence. So just a small vision of where I think healthcare can go, pulling all this together. I have a TED Talk that goes into much more detail. So print, modify, and print going forward is, I think, part of the future of healthcare. All right, you can watch the TED Talk for more. All right, let me finish up with how does all this globalize, right? We're all 40 plus countries here. We can start to share, as you're doing at this great meeting. We can use Internet of Things, satellite applications to pick up signs of infectious disease and do public health before it transmits around the planet. We're even seeing the idea of faxing over vaccines and printing them on site. We're in the era of crowdsourcing data and delivering drugs, vaccines by drone. In Rwanda now, 1,000 clinics are being connected by the Zipline drone service. So major ways to impact public health with drug delivery and vaccine delivery. And what is most exciting, I think, is that we can all play a role in discovery. We can all now download a clinical trial, connect the dots between data, screening, epidemiology, public health information, and use that in real time to speed up clinical trials. So you can all download a trial and play a role in that today. So where this all comes together is to reimagine, just like driving has changed. 12 years ago, we still had paper maps. Now most of us couldn't imagine driving without Google Maps or Waze. Imagine we built a Google Maps for infectious disease, for infectious control, for epidemiology, for almost any disease. So your own personal map as a patient, and we're guided by the experience of others like you, to the ability to connect the dots across countries, endeavors, academics, and companies. And we're seeing examples of that. SickWeather is an app you can download and share your infectious disease history in real time and then go look what's going on. So I think this history is going to get super interesting. Our social network graph has lots of data. It may literally give you alerts before you shake hands with Caroline. I just did. She's okay. But literally, it's going to become real time in your neighborhood and very local, as we hopefully are encouraged to not just be organ donors and blood donors, but data donors as well. So as we move into this future, I hope you realize the future of your field, infectious prevention, healthcare in general, is not any one field. It's the exponential convergence of all of these exciting technologies. I want you not to be thinking about 2019. It's already pretty incredible. We're in 2019, right? We're here. But I want you to be like Wayne Gretzky, skate to where the puck is going to be, because what's coming in the next decade is incredible, right? Bill Gates has the famous quote, people tend to underestimate what will happen overestimate what will happen in a year and underestimate what will happen in a decade. I encourage all of you in the next 10 years in IP and beyond to not take linear steps, to take exponential steps. A lot of the technology is here. It's just not evenly distributed. It's in my pockets. It's our opportunity to not predict the future, but together boldly to create it and create a much better one for all of us. So with that, thank you for your time and attention. If you'd like a copy of my slides, text that number. Thanks a lot.
Who knew he had all those gadgets in his pockets? He kept on pulling them out. So thank you so much, Dr. Kraft.